So this is my area. Welcome to the anesthesia section of the operating room. Usually there's a big blue drape up here, so you don't really see what we're doing. So we're gonna let you behind the drape, so to speak. Few important things. This right here is my trusty anesthesia cart. Has all the things that I need to do any case. So we have all of our drugs, easily accessible. It's lovely. We have, I'll just show you a couple of things. All the syringes, we use lots of syringes in anesthesia to drop all of our wonderful drugs, things for starting at IVs. And here I have breathing tubes and all of that, which I'll show you what that looks like outside of the cart. This is one of my best friends, the ventilator. We can't do most cases without this, at least not here. So this is a bag that we use to kind of help deliver oxygen. These knobs all have different kinds of medical gases we need. What we use here the most is this one, which is the oxygen knob. So during any case, you're constantly getting 100% oxygen pumped into your body through your breathing device. So that's what these knobs are for. This here is where we keep the main drug that you get during surgery. This is what's known as a volatile anesthetic. Nothing that you need to know, I just need to know. But basically, this is the drug that keeps you asleep the whole time. And this is a gas, so it comes through this thing, comes through the whole machine, comes through these tubes, and it ends up coming out here and into your breathing tube, which is what this gets attached to. While you're in surgery, I'm here with you. I'm usually standing or sitting. This is one of the anesthesiologist's other favorite tools. Back here in the bed. And I'm watching you the entire time. You're gonna be on a monitor. There's nothing on here now because we don't have a patient attached, but this monitor lets us keep up with every single important vital sign while you're sleeping. So we're checking your heart with every single beat. I'm monitoring your heart. Every single beat of your heart, I'm monitoring how much oxygen is in your blood. That number comes up here also. Your blood pressure, I'm checking every 3 minutes to make sure that you're staying exactly in the range that we want to stay and the anesthesia drugs aren't affecting you too much. And I'm also looking at how much carbon dioxide you're breathing out the whole time. That's another really important number. And all of that information is registered here on the monitor. So there are a lot of things that are going back here in anesthesia. Top of my ventilator, what you're seeing here are some of my trusty tools also. This is the infamous breathing tube. This is what it looks like. It's just a long tube like this with a little balloon on the end. And that balloon helps to keep this breathing tube in your throat the whole time you're under surgery. This is a different kind of breathing device. I usually will call this a breathing device because it doesn't quite do the same thing, but this is called an LMA. I don't know how easy it is to see, but it's another tube. It has a soft balloon on the end, and that also helps to keep it in place and help to deliver you that gas through this machine. This here is what we call a laryngoscope. Another trusty tool, has a fancy dandy little light on the end. And it helps me to see into the back of your throat and to see the exact perfect place to place this breathing tube. So these two guys go together, and I love them. And I just brought this up because this is like everyone's favorite part of anesthesia, the propofol, milk of amnesia. So we call it that because as you see, it's white and milky, and pretty much every single patient gets propofol unless you have a real and true allergy to it.